My name is Claudio Scaramelli, and I'm a health coach in my own company, which is called Claudio Scaramelli Health and Wellness Services. My company is basically at the forefront of the healthcare, preventive healthcare. So with the aim of supporting people in getting healthier lifestyles and living healthier lives. I think it sounds really promising what we have heard during these 2 days, because I think that the moment that we speak about patient-centric healthcare and also about artificial intelligence, I think we are on the right path. So I think that overall the message is really reassuring, and it's really a positive one. And it's also a message that is shared between all the different stakeholders. So I think it's really encouraging scenario. The thing that I saw is that there are challenges, so there are gaps in the process. Yesterday we talked about having data available. That is a massive improvement in dealing with the patient healthcare, so that we can work on data to have a better treatment, for example, better diagnosis. But at the same time, the hospitals made the point that there is a gap. So meaning we have the data, but the patient is not fully able to action on those data. They cannot fully understand those data. So I think that for me as a health coach, that's a really nice place to be, right? Like a connection, a bridging role, a bridging professional between the hospitals, between medic centers and the patient and their families. So I think that's the first point. The other point, or the other challenge, is where we know that basically we have a shortage of nurses, so we have a shortage of doctors, and at the same time we have an increasing number of patients. So there what we have to do is to move a bit the center of attention from the hospital and the doctors and the nurses to the patient. And to do this, you need to have, in my opinion, health coaches in place that can really support the people when they are ready and still healthy. You cannot really wait for them to get sick and then try to help them. That's too late. That's the moment where you have high cost. While in the early phase, then you can really basically put in place preventive healthcare. As we said before, I think that the moment that we have in place artificial intelligence and platforms that put together or on the same page the doctors, the patient, the family, and any kind of caregiver, this is really a good starting point to have, let's say, a proper management of the patient. So I think that's the strategy is around putting together these two aspects, platforms that are including all these stakeholders, and artificial intelligence that on the other side is helping in getting easier and faster treatments and diagnosis. Networking is a great plus, because you had the chance to meet with like-minded people, even from different part of the healthcare, right? Because you have pharmaceuticals, you have hospitals, you have startups and bigger companies. So having the chance to catch up with all of them and having an idea about the direction of the entire healthcare business, it's really important. That was great. I think it's really something that is making the difference, because from the first minute when you come in and you get the reception till, let's say, every appointment that they set up for you, they facilitate every step of the event. So I think it's really a nice idea, and I think that they are really doing a great job.